MLK Medical Center was a troubled hospital that closed, leaving a community underserved for years. It has since reopened as the Martin Luther King Jr. Community Hospital.
And a beautiful one it is. The hospital is located in LA's Willowbrook section, and it serves much of South LA and Watts.
And some now call it the hospital of the future in the way it serves the community.
And CBS News' Amy Johnson is live in Willowbrook with a closer look at the facility. Amy?
Well, Pat and Rick, it has been 10 years almost since the old MLK Hospital shut down. And as you mentioned, this new hospital is certainly much improved, and it just keeps getting better and better as they add more new and exciting things to the campus. It is a state-of-the-art hospital in South Los Angeles.
We set out to provide high-quality care, and that's what we've been doing.
Dr. Elaine Batchlor is a hospital CEO.
South Los Angeles is ground zero for some of the biggest healthcare challenges our nation faces.
But not so long ago, Martin Luther King Jr. Community Hospital was in shambles, even called Killer King by some, and shut down in 2007.
It was a very difficult decision, but a very necessary decision.
Supervisor Mark Ridley Thomas visits the weekly farmers market and can truly see the fruits of his labor.
Our intent was to build a campus that concentrated on wellness, that concentrated on prevention, and not on hospitalization.
Now it is a top-notch hospital on a 42-acre campus with a rare public-private partnership. The campus boasts a brand new outpatient clinic, a public health center, a psychiatric urgent care center, and a recuperative care center that David McGuire calls home for now.
I don't know where I would be without the program right now.
The 50-year-old battled substance abuse and was diagnosed with colon cancer.
Without this facility, I doubt if I would have had my cancer treatment. I don't think I would have been able to keep it together enough to get to all the appointments, to maintain the constant communication that it needs to be, and the coordination of appointments and therapies.
There is much more planned on this campus, including a behavioral health center, a parking structure, and a new office building.
The hospital is the gem, but there is so much potential on this campus.
Linda Griego has been a big part of the rebirth of the MLK Hospital and the facilities.
Our mission is to really look at the underutilized buildings that are here, like the old 5-story hospital, to enhance the foster care services.
The 133-bed hospital has seen 90,000 patients in their emergency room this year, one of the busiest in the county.
And at the end of the day, what we want to demonstrate is better access to quality care, a healthier community, a revitalized community, and models that other communities can replicate.
This new improved campus is not only helping with the health of the people that live nearby, it is also providing 1,400 jobs, which is also very helpful to this community. I'll send it back to you in the studio.
Much needed, too, for the
That's
community.
for sure, yes.